This is Sarnia Lambton Daily for Monday, March 30th. Good evening, I'm Terry Doyle. 4 residents of Sarnia Lambton have died as a result of COVID-19. This news was released by Lambton Public Health today. The total number of positive cases jumped over the weekend to 28 by midday Monday. 3 of the 4 deaths were residents of Sarnia's landmark village. At this time, it is the only institutional outbreak in the region. 65% of all cases in Sarnia Lambton are among people over the age of 70. Let's go to Point Edward now, Lambton Public Health, where Dr. Sudit, Ranade, Medical Officer of Health, joins me now. And Dr. Ranade, we've seen a significant increase in the number of positive cases since really the start of the weekend, but I understand this is a case where lab results are finally coming in a lot of cases.
Yeah, that's right, Terry. Hi. At first, we got a few cases here and there. So we started off with 5 and then 7. But over the weekend, we got a number of cases in. And I think what's happening is that the lab is processing a large backlog that they had. And so, yeah, now we're up to 28 cases and then 4 confirmed deaths, which is really very sad.
So as you work through this, I understand it's now with the many positive cases going through and tracing what contacts these people may have had. Maybe you can fill us in a little bit more on how that process plays out.
Sure. So every time we get a case, what we try to do is try to understand where has that case been, what have they been doing, what are the social networks in which they operate, and see if any of them are connected. So when you only have 4 or 5 cases, it's very challenging to do that, especially if you can't make the links right away because the people seem like they're not connected. As you get more and more cases, you find more and more connections between people. And so what we're learning is that there's at least one group of people who's connected to a trip that happened to Europe, a group trip to Europe. But there are some other people that seem to be connected through family gatherings, through faith community gatherings, things like that. It's not unexpected. And what we're trying to do now is work back to say, are any of those sources or gatherings or trips connected to each other? Like, is there one common source or are there just multiple sources? That's kind of where what we're trying to learn still.
You mentioned the travel with Europe and the groups as well, but because the way COVID-19 plays out, not just the testing, but the way it shows itself, are you finding where these people maybe traveled, well, this happened 2 weeks ago, 2.5 weeks ago in some cases, even before the orders, because people are going to see this and think, well, they went to Europe and they didn't self-isolate or didn't self-quarantine right away, but it turns out some cases this was even before those orders were put in place.
That's right. All of the people that we've talked to who came back after people were supposed to quarantine themselves, they did that. But these are exposures and things that happened before. So people would have returned when there were no real restrictions on travelers. And then, of course, they did what any traveler would do, which is to go back and tell their family about their trip and tell their friends and go integrate into your social network, right? So it's not that these people did things that they weren't supposed to do. They did things that everybody would do, and there were no restrictions at that time about what you did when you came back from travel. What we're finding that's very reassuring, though, is that the later exposures of those people, many of them say that as a result of the changes to the rules around gatherings, and many organizations and faith communities, for example, had even before that stopped delivering in-person services or having in-person gatherings. So there are many people who would normally have gone out to do other things who we found have not been able to do that because those things were shut down in advance.
And as we go through this, that's where it's sort of a delayed effect, where at least we are seeing now people that have heard the news and obviously are following those orders. I guess that's got to be, at least, as you said, reassuring that people are buying in here and knowing, indeed, take those steps where you might feel fine now, you came back from a trip, or either way, you have no symptoms, you feel fine. No, take these measures because it is so important.
That's right, because we know that 80% of the disease spectrum is very mild. So people don't have major symptoms. And so they might feel like it's a little cold that they're walking around with, but in fact, it might be COVID-19. And so that's why we really want everybody, whether they have symptoms or not, who has traveled to just stay in place for 14 days.
Before you joined us, we talked about an outbreak at a local seniors community. I'm sure that's always a challenge for public health because of the demographic and because of the close proximity of residents. And we're not talking just COVID-19. I've got to think anytime there's an outbreak, that's always a challenge to any of those institutions.
Absolutely. I mean, we work with institutions constantly through the year on outbreaks. mostly long-term care, but also other facilities. And anytime you have people living in a communal setting where they might share communal experiences, there's a risk of transmission if a case does present itself in one of these settings. So we work with those folks very closely, especially in this particular case. We know that disease can be more severe if you're older. So we want to make sure those folks are well protected.
As we continue on, I assume we know that at least there are a few people who have tested positive but indeed have the mild symptoms. And is it a case those people would be sent home to self-isolate?
Yes, all of the people who were tested, the minute that they were swabbed, the care provider, whoever was doing the swabbing, would have told them that they needed to go home and isolate themselves until the test result came back. And if the test result is negative, then we say they can go back to normal physical distancing. But if the test result is positive, then we further isolate them. So all of those people would have been instructed to self-isolate. Certainly now, it's even more important as well for just people without symptoms to practice physical distancing.
As we go through, you've told us for weeks that we knew it was in the region, take precautions as if in the region. Is that maybe I don't know if frustrating is the right word, but obviously knowing where people maybe think, okay, yeah, I haven't seen anything. Now I guess you're hoping people will take it even more seriously if they weren't already, because we kind of have this delay between instructions, now we're seeing the positive tests, now saying, okay, remember we told you, please, physical distancing is so important right now.
Yeah, I agree with you, Terry. I mean, I think some people are going to take it more seriously because there have been cases and deaths, and I want them to. I think there are a lot of people, though, that have been doing what we've asked them to do. I think in some ways we were very lucky because we were putting out this message with enough time for people to build this habit, to recognize that it's not something that happens overnight, but it's something you have to consciously do. Staying 2 meters away or a hockey stick away from people is not a normal kind of feeling. It's not a normal thing to do. So we hope we've given people enough time to get adjusted to that so that it becomes a routine part of what they do every day.
Is there concerns with the warmer weather over the next little bit? People might let their guard down a little because people just want to get outside and do something. But I guess at the same time, what is the message? Can people, spend some time outside, but as long as they're still maintaining physical distancing? As you said, I think the great line, the hockey stick away.
Yeah, I think that we definitely want people to get access to the outdoors, right? It's an important part of people's health. I think there's a way to do that safely, which is to stay 2 meters away from people at all times and limit your excursions to just your immediate family network, right? Your household people that you might go for a walk with, but not I'm going to meet up with friends for a walking group. That defeats the whole purpose. So we do want you to get outside. That becomes harder in places like the GTA where you have very high population density because it's harder to stay away from people. But certainly I think in Lambton County, in our community, it's possible to enjoy the outdoors safely by staying away from other people. And we want people to do that. We don't want them to go stir crazy because they feel like they have to stay indoors in their place of residence the entire time for however many weeks this goes on, right? We want you to get outside, but safely, which means stay away from other people, limit your physical contact with others.
Dr. Sudit Ranade, we appreciate you giving us a few minutes today for you and your staff. Certainly stay safe and keep up the great work.
Thank you, Terry. You too. Thanks.
There's Dr. Sudit Ranade, Medical Officer of Health. You're watching Sarnia Lambton Daily on your TV. Welcome back to Sarnia Lambton Daily. As the entire region deals with the COVID-19 pandemic, we try and find a silver lining. Situations where members of the community are trying to help their friends, neighbors, and fellow residents of Sarnia Lambton. One area we have seen an increase in is fundraising. People willing to support their friends and neighbors while maintaining physical distancing. Kathy Alexander, Executive Director of Bluewater Health Foundation, joins us now. And Kathy, I understand people have been reaching out to you wanting to know how they can help people in the community during COVID-19.
They sure have. Hi, Terry. How are you? Thanks so much for having me. And we just blown away by the incredible offerings of support and generosity to help our healthcare professionals at Bluewater Health. And as such, we have launched today a COVID-19 emergency response fund within Bluewater Health Foundation to really provide folks in the community with an opportunity to give back at this time of need.
And I'm sure that's the thing you see and hear all the time, is that people wanting to step forward, wanting to help out. And of course, in this case, with physical distancing, we're keeping everyone at home, keeping everyone apart. But I'm sure there's still people that they want to be able to do something. And here was an opportunity. And I've got to guess over the last 72 hours or so, that's what you were hearing from people. What can I do?
Yeah, and I feel very privileged, Terry, that in my role, each and every day I hear from folks that say how grateful they are to Bluewater Health and the people that provide care and compassion. But yeah, over the last week or so, people have just been regularly, consistently reaching out to myself, my team, people that they know at the hospital that work there, and really just wanting to know what they can do to make a difference and what they can do to give back. And Sarnia Lambton truly is a community with a heart of gold. They really want us acknowledge the incredible efforts of those people that are working. Hospital staff work around the clock every single day, but even more so now during COVID-19. And we just really wanted to provide that opportunity for people to give directly to Bluewater Health and work with the hospital to identify the highest priority needs that they need to use to respond to the situation that is evolving and changing every single day.
And of course, as you said, this is evolving, but what are you hearing, or what's the sort of the idea where funds raised specifically in this fund? What are some of the ideas where that may be earmarked towards?
So really I guess the sky is the limit with respect to what it can be used for. And I think that was part of the essence in putting the fund together, is we want people to have an opportunity to give. And we would work closely with the hospital, because it could be things like a piece of equipment that we really needed that we maybe didn't have before. It could be to support the purchase of, PPE for staff and physicians to ensure that they're safe in the care that they're providing. It could be used to help provide iPads to patients that are not able to access people that they're regularly used to seeing with the no visitor policy in place. So really, we will be utilizing the funds for what the hospital deems to be the highest priority need, and responding to, like I said, in every situation. So one day it could be we need funds to support A, and the very next day it could be the funds to support something completely different. So we're really leaving the fund a little bit less tied to a specific one item, but rather giving a little bit of flexibility in what the funds are utilized for, specifically to respond to COVID-19. And we've seen this across the province and across the country, where hospital foundations are really looking at this as a way to work with community supporters, and hospital foundations exist primarily just to do that. We are so grateful and so privileged in Ontario that our day-to-day operations are funded by the province. We see them stepping up each and every day with more funding announcements and opportunities for expanding the care that's provided. But the equipment and ongoing program needs and things of that nature truly are and will continue to be the responsibility of a generous community. And that's really what we're doing with this new fund, is asking people who are able to, because we're also very cognizant that the current economic climate is not that ideal. People are closing up their businesses, people are not working, people are being laid off. We're seeing, the highest numbers of accessing unemployment in our history. So if people are able to give, and every single gift, every single denomination does make a difference, we are asking them to consider doing that to support Bluewater Health at this time.
People watching us now, if they want to contribute, how would they go about doing that?
Well, the easiest and safest way from a social distancing, methodology is really going to our website. It's a secure website, bwhf.ca. Donate. Something that's really important we've added there as well is an opportunity for those who are giving to leave a message or a kind word or a comment for our healthcare professionals, and we in turn will assure that those messages get to the folks that are working with such care and compassion, letting them know that they are truly respected, acknowledged, and thought about. Every single day I'm getting messages of people just wanting to say, wow, we are just so fortunate to have the people at Bluewater Health at all levels, not just frontline. This takes a whole village. So people from the administration to the back end, to the front end, to the screeners, to the physicians. Bluewater Health really is an incredible team effort, and we're just proud, the foundation, to be a small part of that. But the community effort is unprecedented. COVID-19 is unprecedented, but the kindness and the compassion that we're seeing, again, we truly live in one of the most wonderful communities, and we feel honored to be able to share those messages back with.
Kathy, quickly shifting gears, recently wrapped up the Dream Home Lottery, and I know once again a situation where the community really gets actively involved, gets engaged, and of course wants to win the big prize, but at the same time knows the funds go a long way.
Oh, so we did, just wrapped up. We actually did a virtual Dream Home draw, which was not how we had intended to celebrate our 25th year anniversary of the lottery in our community, but through a partnership with the CEH Foundation this year, for the first time, we had our largest prize board in history. We sold a record amount of tickets, and we were so excited to be able to share some good news with folks in the community. And again, part of my role is I get to call the winners, which, how fun is that? Hey, guess what? You won a dream home. So I got to call people this year, and the very first thing was not even about the house. It was about how important the proceeds are, especially this year, knowing everything that healthcare professionals are dealing with at this time. So the messaging of gratitude from the winners of the Dream Home was just really about, you know what, I bought a ticket, it would be great to win, but if I don't, we know that the cause is so important, and that's my donation back to our community. And I think we're very fortunate with our Dream Home Lottery is that we demonstrate very, very clearly to the community that every single dollar that's raised stays locally in Sarnia Lambton and supporting both sites of Bluewater Health. And very excited actually to say that we're planning already for next year's and working again together with our sister foundation in Petrolia to support both sites of Bluewater Health.
Well, Kathy, we appreciate you joining us. We'll let you get back to work because we know donations are already coming in. So all the best, and we'll catch up with you soon.
Thanks, Terry. Stay safe and stay healthy. Thanks for having me.
You as well. That was Kathy Alexander, Executive Director of Bluewater Health Foundation. Meantime, last week we told you about the new fund set up by the United Way of Sarnia Lambton, the Compassion Fund. This was to help assist local organizations providing additional services to support people during the pandemic. The United Way announced today the first 3 recipients of money from the new Compassion Fund. The Family Counseling Center has seen an increased number of calls for referrals through their Distress Line/TellCheck program. The funding will allow them to bring on more staff to deal with the increased call load. While the local Boys and Girls Club is closed, programs are still being operated remotely. Additional funding will allow them to support some low-income families, many who previously relied on school breakfast programs. The Salvation Army has seen an increase of clients accessing its food bank, as many as 25 households per day. The funds from the new United Way Sarnia Lambton Compassion Fund will help purchase food and hygiene products. We know it can be difficult to keep children occupied during this time off. Coming up after the break, an organization has put together some activities parents can download from home. Welcome back to Sarnia Lambton Daily. This is the start of week 3 of schools being shut down, when you include March break, of course. Combine that with physical distancing measures, and we know some kids may be going a little stir-crazy at home. Here to bring you some ideas is Kevin Cougler, the CEO and founder of STEM Camp. Kevin, thanks for joining us. First of all, what is STEM Camp?
Well, thanks for having me, Terry. My pleasure to talk with you today. STEM Camp is a not-for-profit organization, and we run summer camps for kids within the STEM space. So that's science, tech, engineering, and math.
And of course, we know as you're joining us from the home office in Woodstock, you do a regular camp in Sarnia as well that I'm sure, waiting to see what happens this summer, of course, with everything changing. But obviously, I think you cover a good chunk of this area of the province.
Yeah, we do, Terry. We have 48 locations in southwestern Ontario. And we are kind of on pins and needles right now. We're in full planning mode. We're preparing to have camp this summer, but of course, we'll follow the guidelines of the government and the health professionals.
Now let's talk about some ideas, and I understand you've launched a program where taking the camp idea, but of course at home.
Yeah, that's right. It's interesting, when this all kind of broke a few weeks ago, I think we were one of the first organizations that actually started sending our staff to work from home. And so long before the government mandated it, and when we made that decision, we had a feeling it was coming, and we were trying to figure out what the role was that we could play in all of this. And obviously none of our workers were frontline healthcare people, or we didn't have financial resources to donate, but we thought we could play a role in just making some activities for families and kids, maybe be a distraction to the stress that they're feeling, give them something fun to do during the day. And since that's what we're all about in the summer, we thought, well, let's just do that and see if there's some uptake for that.
So what sort of activities will people see if they go check it out?
Yeah, well, it's kind of a mixed bag. I mean, the first thing we had to be conscious of was that we didn't ask people to, by doing one of our activities, go out to the grocery store or go somewhere else, because of course we're all locked in our houses for the most part. So we had to try and come up with some activities that allowed for the materials to be found within the kitchen. Or within the house environment. So we came up with some on our own, but we also scoured the internet to see if we could find some that we thought would be appropriate for that. So some of these relate to COVID-19, helping kids understand what hand sanitizer and what soap does, and others are just kind of fun activities like making maple syrup candy, which I think every child would like to have some candy during this time.
That's a good way to get their attention. Absolutely, with candy. Is there an age range that these are geared towards?
Yeah, so STEM Camp is age 5 to 13. So of course we can't do the same activities sometimes for 5-year-old or 13-year-old. So every day the activity might be a different age demographic that we're targeting. It could be 5, 6, 7-year-olds, or it could be older kids. But of course, I think the candy one I mentioned, that'll apply to all kids.
Absolutely. That's going to get their attention. Even the big kids, even the parents might just want to jump in on the candy as well. I know this is new, but I'm sure you're looking at where probably giving these children and parents, of course, just different activities where variety, I've got to think, is a key right now, as here we are into week 3 of schools being down.
Well, that is key. And some of the parents are actually doing some of the activities, and they're geared for some of the parents to do with the kids. Like one of the favorite ones that I have, which is very appropriate right now, is how to make your own homemade toilet paper, right? So in this craze where everybody was stockpiling toilet paper, we thought that would be kind of a fun one to put together. So you have to go outside and grab some grass and some dirt and mix that together with some other ingredients that you find around the house. But that's kind of a fun one for parents and kids to do together.
For people watching us here on Sarnia Lambton Daily, want to find out more, want to get access to these activities to work with their children with, how do they get access to them?
Well, the best way is just to go to our website, stemcamp.ca, and follow the link that's right on the main page for STEM Camp at Home. And I think there's somewhere around 10 or 11 activities already up there, Terry. So they should be able to get everything they need right there.
And I understand there's a contest you're working on as well.
Yeah, every day has a contest, and the contests are easy. Don't worry, we don't ask you to do too much for that. But it's all STEM related. And well, actually I can give you here's a really easy contest that we're doing today. So this one's for the kids, because the parents of course will know the answer to this, but it's a trivia question. And the trivia question is our son actually considered a star? And of course I won't give you the answer over the interview like this, but that's, if they answer that question and they answer it correctly, they'll be entered into the draw. And every day we give away a free week at STEM Camp as part of that contest. So I think that's been getting a lot of attention, and certainly they're having a lot of fun doing that.
So if you want to answer that question, go to the STEM Camp website. We've shown it on screen there. We'll show it again here in a moment as well. That's where you can go download the activities and of course be able to get a chance to enter the contest as well. Do you have some idea? Is it a case where trying to continue this along as long as possible with fresh activities, considering we don't know how long this pandemic is going to continue?
Yeah, so far we're scheduled to keep this going to the end of the week. We might continue it a little longer. We've had great response from the parents. They love it, which is fantastic. But we're also going to pilot something different. Now this topic of virtual learning, outside of the classroom at home, and parents are becoming the teachers, and it's all very relevant to our Premier's mandate that we might move to a more virtual environment the next coming months. So in preparation for a summer STEM camp that might have to work to a virtual model, we're going to pilot virtual STEM camp next week. So what that will look like is some families that every day we'll be able to connect with some of our camp counselors, and they'll do activities together over the internet.
Well, Kevin, we'll leave it right there on a positive note. We appreciate you joining us.
Thanks, Terry. My pleasure.
That will do it for Sarnia Lambton Daily for this Monday, March 30th. You can see us every weekday here on Your TV beginning at 6 o'clock, or catch us on our YouTube and Facebook pages at Your TV Sarnia beginning at 7. I'm Terry Doyle. We'll see you tomorrow for more of Sarnia Lambton Daily.